Hey you guys, it's Dr. BT, and I want to do an overview for this summer's OB class. So you can see this is our site. We have a nice summer setting. She's at the beach with her nice hat on. She probably should have on long white sleeves, but she's enjoying her time. So here's me, Julie Baker Townsend. We're going to have our classes on Fridays from 11 until 12:40 in building 39A, which is the nursing building in room 1030. Class attendance is part of your grade. So I do expect all of you to be at class. You guys, this is a super fast class. I usually do this class in 18 weeks and we're doing it in 11. So you need to come to class, you need to listen, and just take notes. I'm very good about being pretty direct, but you need to come to class. Correspondence, I check, don't use Canvas for emails. I take that back. I'm going to change that. Email me at jabaker@unf.edu. And my cell phone number is 904-463-3238. I don't text for class purposes because I'm old and texting's kind of hard, so I don't do that. If you need technical help, you can go to the help desk here. Okay, so let's look at what we got going on. We have the syllabus. Here is the syllabus. And so you're accelerated, you're taking a load of classes, you're taking this complex and introduction to nursing science. So you will be very busy over the summer. If you have accommodations at SAS, you need to let me know and you need to register with them. And we're happy to accommodate you. Attendance is mandatory. You get grade points for it. And, we just want you to pay attention in class. You have to be, in compliance with My Clinical Exchange. If you're not in compliance with My Clinical Exchange, by the time that Dr. Adams tells you, you'll get an unsatisfactory for professionalism. People just don't want to do their thing. So that's our new policy, is that if you just don't want to do it, that's okay. You just get that unsatisfactory. So please just do what you're supposed to do and you'll be good to go from the onset. You have to get a 73 in the class on your testing grades in order to pass, and this is throughout the nursing school. You'll have to go to clinicals. I posted my clinicals. We cannot skip clinicals. You cannot take off for clinicals. You cannot miss clinicals. If you do miss clinicals, it's going to be a 10-page APA paper. We don't have the time. You have to make up the 10 hours. So how we do that is a page an hour for the time that you're at clinical. So that's 10 hours, 10 pages, which is pretty good, on the area that you missed. So if you miss 2 days, you cannot pass. If you miss 1 day, then you can do the makeup assignment. You have to pass your math test. Dr. Comey wants you to have one done in the first few days of class, and then if you are not successful, then you can take another one, but we have to get it done by that first week. Our book is Loudermilk, Perry, Kashan, Alden, and Olashenki, and it's actually 2020. There was a pre-one made in 2019. So it is the 12th edition, so make sure you get the 12th edition. And so here's how our grades shake out. Examinations are 40%. The cumulative exam, the final exam, is 30%. So you guys, you have to study for these tests. These tests aren't tests that you can get by with minimal study. You have to know the content. I'm very direct about the content. I try not to leave a whole lot to, to chance. I give test maps. I'm very direct, but you have to be able to go through the content to know it. That's 70% of your grade. Quizzes and shadow health will be 20% of your grade. Adaptive quizzing at the end is 5%. And then again, here's your class participation and attendance is worth 5%, which goes to 100. The adaptive quizzes are pass-fail, and they're on learning mode. So as long as you pass them, you'll get the complete 100% for 5% of your grade. You have to take your HESI. That's another thing. So with your HESI, you'll take it a couple of weeks before class ends. If you're not successful with an 850, you'll need to do the remediation, and then you'll retake your HESI before the end of the semester, before you can move on. The exams are about an hour, and then this goes on to the course objectives, which just kind of talks about everything we're going to do in the class. I'm going to scoot on down here to clinical. In clinical, you will need to bring a couple of concepts for each day that you're in clinic. Then you'll write a SOAP note. People say, I don't know how to write a SOAP note, Dr. BT. Well, you write S, what the patient says. O, the things that you observed, you assessed, that were in the lab values, body movements, vital signs, diagnostic tests, anything that you observed that's concrete. And then A is your nursing concept. And then P, what are you going to do about it? What are your nursing interventions? So grading for that is pass, fail. And then you're going to need to turn in your evaluations. So you guys, for the community event, Dr. Como and I have several events that we can talk to you about for your community engagement. And you're going to need 4 hours for this class. And we'll talk about that on the first day. So you're going to need 4 community hours. Then you're going to need to do your journal, and then you're going to need to write it up. This form, which is the last page of your syllabus, you're going to print this page, and you're going to print this page, and you're going to give it to your clinical instructor the first day of class. At the end of your evaluation, so you go through to clinical, you go to sim labs, you go all 4 days, and at the end, they're going to go over this with you. At the time that they go over this with you, upload this to your Sun portfolio so that you don't have to worry about it. So we don't want you to have any stress, so just upload it at the time with your clinical professor. They'll give you 5 minutes to get it up there, and then you're good to go. All right, so that was the syllabus. Now let's go to the lecture schedule. So the lecture schedule, you're going to have a couple of things the first week. So these are week 1. Here's the dates, here's the times, here's the locations, and then here's the activity. So Monday through Wednesday, you're going to need to get your drug dose calculation testing completed and your prerequisite anatomy and physiology review quiz. This is just an overview of what you did in anatomy and physiology to bring you back up to speed. By Thursday, you need to have your OB-PED simulation preparation completed, and I'm going to show you that in the modules. Then on Friday, we are going to do neonatal. The reason we do neonatal first is because you're going to be going to the NICU and you're going to be going to PEDS, plus you're going to have neonates on the PEDS floor. So it is more appropriate for us to do neonatal first before we do pregnancy to give you a better understanding of your clinical when you're there, and that's our whole goal. So you'll come in early. Dr. Como's class starts at 9 and you'll be here until 7. It is a day packed full of information. We're going to get you ready to go to the hospital. We're going to do some simulation. So we're going to be very, very busy on that day. Make sure you bring lunch, bring snacks. So we're here all day and we have a lot of work to get done. Do not miss this day. This is clinical time. This is clinical hours. If you miss these clinical hours, it counts for clinical absence. So do not miss this. And this is why I posted it on those clinical days when you signed up for clinicals, so you would know to keep these times and dates open for coming to this simulation lab. So you guys, every week there'll be quizzes, there'll be online quizzes. It's just so that we can get through the material. The quizzes are pretty straightforward. They're not crazy difficult. Most of them you can take as many times as you like. There's a few that you cannot. So Monday, May 23rd, we're going to have simulations, and I'm going to put up a sign up, what's that called? Not GroupMe, but it's a sign up that is on a website that you can sign up in groups to come in for these clinical times, and it'll be 8 until 5. You'll probably be here 2 or 3 hours on Monday. There are two groups that will not be able to come Monday because they will be in PEDS clinicals. So those 2 groups will come after Complex on Wednesday. Then we're going to start neonatal. We're going to finish it on May 27th, neonatal, 11 to 12:40. If I get finished, then I'll start antepartum. Of course, we have Memorial Day on the 30th, no classes. June 3rd, just regular class. And we're going to have our first test from 7:30 to 8:30. Then you'll have Dr. Como's class, and then you'll have my class thereafter. We try not to test during class time because it's just so short that we can't afford to test during the class. And then you guys, you can see all of this, and this is just all the same things. I'm just kind of going to go through it. Juneteenth, we're off. On Friday 17th, we recognize Juneteenth. And then on Friday the 24th, we have a test. That's my second exam from 7:30 to 8:30. And we have nursing interviews. So I will have a recorded lecture for you guys. Plus we'll have weekly quizzes. Friday, July 1st, we'll be moving on to postpartum. Of course, we'll have our weekly quizzes. You're off Monday, July 24th. Friday, July 8th, we'll be doing high-risk postpartum. You'll have your PEDS 2 test in the morning prior to starting. July 11th, we'll have adaptive quizzing due. And so the topics on adaptive quizzing are antepartum, intrapartum, postpartum, and neonatal. So I'll be opening the adaptive quizzing after we cover the content, and then you'll make sure that it's all due here. And you get 5% for your adaptive quizzing. July 15th is my exam 3. This is a big day. You'll take my exam. Then we'll have women's health class. We'll cover about contraception and breast health, endometriosis, fibroids, things like that. And then you'll have your HESI exam from 1:30 to 3 afterwards. On June 10th, on the 10th week, July 22nd, we'll do women's health, and you'll have PEDS test 3. Let me take this. I don't know why it says on Monday, July 22nd. I apologize about that. I'm going to have to ask Dr. Como about that because I typed it as I was talking to her, and we'll have to clarify that one. The retake for HESI is July 29th. So if you didn't make an 850, you'll have to do your remediation, then retake it here. I'll do a final review from 11 to 12:40 after that, and then we'll have our final for OB on August 2nd from 8 to 10 in the computer lab. All right, so now let's look at clinical schedules real quick. So I'm going to go back up to modules. And let's look at clinical schedules right here. We have Baptist South. This is our first clinical, starts on 5/24. These are every Tuesday. These are 10-hour days. Dr. Nadine Ellis will be your clinical faculty. They're super busy here, and so get ready to go. We want you to be involved. We want you to be active. There's no sitting. There's no time to sit. You'll be responsible for doing discharge teaching to the patients. So we're going to send you in, and you'll read over the discharge teaching, and you'll go to deliveries, you'll go to C-sections, you'll go to circumcisions, you'll go to laboring patients. This is just a great experience. Orange Park, the same. You'll have Dr. Lily. Almost Dr. Lily. She's a DNP candidate. She'll be graduating with her doctorate in the summer. And you'll have the same dates, 524, 531, 67, and 614. Ms. Thomas will be at St. Vincent Southside. They're busy. Same thing. It'll be an awesome experience. They're busy too. This is the really busy time. This is our second group from 621, 628, 75, and 712 at Baptist Medical Center South with Ms. Thomas. And then Ms. Lily will be here at Orange Park for the last rotation. So don't miss clinical. I just can't say it enough. It's super important. Okay, so let's go on down here. Here is your review. So it's clearly marked that it's due by May 18th at 11:59. And so if I click on this, here's the instructions. I watch the video, I have the information, and then I take the quiz. This particular quiz, let's see if you can take it as many times as you want. Let me go back here. I don't know. Some of them will let you take it over and over, and then it will say if it does not let you. But you see what you got wrong. You have to finish this one. You have to complete it by May 19th at 11:59 to have our simulation on Friday after class. So make sure that you do this one. This is information for the hospital, which I want to go over with you in class. So go ahead and get all of these done leading up to our class. Here is what you need to do over the weekend of the first week. This is for Tuesday, May 23rd. These are due by Monday. Our simulation lab is on Monday the 23rd. And so these are due by Sunday evening, the 22nd at 11:59. So you need to do these assignments. They're quizzes. And then after we get through the first week, these quizzes are due by May 26th. These you can, this one is once and done, but these you can take as much as you like. So every week there'll be quizzes that have to be done. You can use your notes, they're relatively benign and they help you to understand the content. This terminology, this is just a simple math calculation. This one's a little more complex, and this one is too. And then this is our antepartum start. So you guys, I'm looking forward to having you this semester. Again, if you have any questions, please email me at jabaker@unf.edu. I'm happy to answer any questions. I'll open a discussion board for any questions that you may have. And I'm opening this up early so that you can start working on these quizzes if you choose. So I'm very excited about having you this summer. So thank you.